I'd like to discuss the question, does chronic Lyme disease exist? Despite having been in practice for 37 years, the debate continues. This is part of an ongoing Common Sense Lyme series that I work with on patients that I've seen and controversies that my patients have been facing. I'm Dr. Daniel Cameron. The ongoing debate has been around for 37 years. I've been in practice. Some patients remain symptomatic after treatment. In fact, at least 1 out of 3 have been chronically ill on follow-up, on long-term follow-up. Also that several NIH-sponsored trials have documented how severe these chronically ill Lyme disease can be. The medical community is divided on its existence, despite all the evidence. Some of the medical skepticism is the conclusion that some people make, including doctors, that they're due to lingering, which is a functional psychiatric problem, autoimmune, or residual inflammation. Some think it's just leftover debris from an infection. There's no universal test that can clearly help with the definition of Lyme disease and chronic Lyme disease. But evidence-based medicine typically wants proof, but yet patients remain sick, and so we have to make the best we can of what we know from research and clinical practice. So chronic Lyme disease reality is that patients remain fatigued, joint pain, autonomic issues, neuropathy, POTS, all types of issues. They may sweat, they may have a sensory overload, their neuropsychiatric issues may be a problem. Some people use the word encephalopathy to refer to like a brain fog. The Lyme long-term effects are increasingly recognized in medicine, just the debate continues. Post-treatment Lyme disease syndrome is typically accepted by doctors who reject the idea of an ongoing infection. So if a patient remains sick, from my perspective, why not consider a persistent infection? In fact, the discovery of Babesia, ongoing Bartonella questions are bringing up the issue of persistent infection. Also, a treatment for persistent infection has showed successes. Even in the Fallon-based clinical trial at Columbia, the trial did not help memory and concentration, but it certainly helped the fatigue. There's also a clinical trial called STOP, where there was significant gains in fatigue. I don't think we should ignore persistent infection concerns. Many patients in my practice improve with retreatment, and the research is coming out that persistent infection is increasing a recognized problem. It could be because of the persister theory. The persister theory is based on tuberculosis, where patients remain sick even though it might take months before that infection is cleared. And Lyme, with persisters, they might take longer than you might expect to clear the persistent bacteria for Lyme disease. So what does this mean for patients? Chronically ill Lyme disease patients, whether you call it chronic Lyme disease or post-treatment Lyme disease syndrome, is I would encourage people to keep the persistent tick-borne infection alive. Even the CDC has acknowledged that a persistent infection is a possibility rather than just autoimmune. Doctors, I would encourage to listen, acknowledge, and be open to the evolving science. The right treatment is going to make a difference between suffering and the potential for recovery. The final thought, it's not about proving a point. It's about helping people get their lives back. So thank you for joining me for this Common Sense Lyme disease series.